Hey, Dr. Dave Schwartz here, Team Chiropractic, talk about chiropractic safety, what patients should know. So remember, this is really important. Your safety is always our top priority at Team Chiropractic for you, your family members who are patients, and anyone you refer to our office. We always want you to understand your care. We find that informed patients get better results, and we always want to answer your questions. So questions are always answered at the table, or if you need longer questions or more in-depth conversation, make a consult and we'll schedule that and get you in one of the offices. So what is chiropractic care? Remember, we focus on the spine, the joints, and the nervous system, how all those things come together, help to reduce pain and improve movement, and ultimately help your body function at 100%. Can be done in different ways. We use hands-on techniques, or we also use instrument techniques, an impulse and activator, as well as a drop table. And your care is always customized to you. So we don't treat a 20-year-old college football player the same way as we treat an 80-year-old senior who's maybe got some osteoporosis or some degenerative joint disease or something like that. Care is always customized to the individual patient. Is chiropractic care safe? That's the big question we want to answer, and the answer is a resounding yes. And there is a lot of research that backs that statement. First, there's a study done that shows that patients who started a chiropractor actually have fewer adverse events than those who start at a primary care doctor for neck pain and back pain. There are millions of visits every year. Most patients actually feel relief right away rather than pain. But of course, your safety depends on the skill of the practitioner, their experience. We've got over 70 years combined experience in this office, and communication with the patient and a proper exam and history. Some other stats, the incidence of adverse reactions from a lumbar adjustment is about 1 in 100 million. For a neck adjustment, it's about 1 in 2 million. Compare that to, say, spinal surgery. You're talking about over 15 per thousand, or even taking a non-steroidal anti-inflammatory drug, it's over 3 per thousand. So the alternatives, which usually we see people who don't do chiropractic, they go down the path of drugs or surgery, are much more dangerous, whereas chiropractic is really about the safest intervention you can do. One of the things that comes up every couple of years is we hear about, is there a risk of stroke from going to the chiropractor? And the thing that causes that, sometimes what we call a cervical artery dissection, where one of the arteries that goes up through your neck tears. And there's several things. Obviously, that's a big concern for us. The biggest research that just came out, put out in a National Institute of Health publication, says that there is no convincing evidence that there is a causation between a chiropractic adjustment and a cervical artery dissection. So that's really important. What I think happens is, one of the things that symptomatically happens when you have that kind of problem in your cervical artery is you develop neck pain. And people with neck pain show up at the chiropractor. So sometimes that happens, at the same time, but it's not caused by the chiropractor. And that's something that happens. Sometimes people just turn their head the wrong way. People who go to the beauty salon and they're leaning back, getting their hair washed, have strokes every year. So we take great care to prevent that here. Our technique in terms of how we adjust you, remember the spinal reengineering, trying to restore that curve, is more of a back to front technique rather than a rotational technique, which is the one that if there is any danger, that's where it is. So we always try to keep you as safe as possible and take a good history, make sure you don't have any risk factors. And those who do or are at risk for that, a lot of times we'll just do an impulse adjustment, mechanical adjustment with no actual manual movement or rotation in the spine. So our track record is awesome when it comes to safety in that regard. The big things, how we keep you safe, review your health history. We want to know, that's why on your first visit, we do that long exam, and people come in with their low back hurts, and why are we asking about all their medications that they're on and all their histories and the surgeries that they've had and accidents going back to when they were kids? Because the more information we have, the better we're able to keep you safe. So that's why we kind of really get into detail about that. It's why we always examine the whole person, not just one part of their body, very thoroughly before your treatment, and then we adjust your techniques to what you're comfortable with. Remember, we have in our office 3 levels of adjustment. So the first one, the lightest one, is an instrument assisted, which we use either the activator, which is this little tool, which delivers a little single click, or we have our impulse tools, which deliver a series of clicks. Those are the ones you kind of hear tapping when you're in the office. We use those a lot. The second one is what we call the drop. That's where the table lifts up. We'll give a little push on there. You'll feel and hear the table drop down. And then the third one is the more traditional kind of manual adjustment, and that's where you actually feel or hear things move. A lot of times we'll have people and they're trying to get their spouse in there or their neighbor in there, but oh, my husband doesn't like that crack. He doesn't want to hear that crack. He went to a chiropractor one time, they popped his neck, he didn't like it. We don't have to do that. So there's always other ways, other techniques, very light, very safe, that you don't actually hear that popping in there. Other people, they love the kind of the more aggressive adjustments. That's kind of how I am. When Dr. Dodd or Dr. Leary, Dr. Mohar adjust me, I like to kind of hear stuff move, but sometimes some people, they don't respond well to that. So one of the things about having an experience in a team of doctors, we're going to find out what works best for you. So things you always need to tell us. Let us know when you've had any recent injury or car accident. That's going to change your care. It's going to change how we treat you. We may have to take a new x-ray to see how everything is. If you have osteoporosis or osteopenia, any decrease in bone density, that's very important because that's going to affect how we treat you, and we're going to adjust you much lighter if we know that's the case. Numbness, weakness, dizziness, if you've had surgery or are pregnant, all those things are really important. Doesn't mean we can't see you. We can, but it means we modify how we adjust you. We see people all the time. They had, let's say, an abdominal surgery, or they've had eye surgery, even open heart surgery. And, you know, I can't lay down on the table and let you push on my back like you normally do. And that's fine. We can adjust you seated. We can adjust you on your back. There's always ways we can do it. My general rule of thumb is if you can get in the car and get here, we can adjust you. So sometimes we do have to modify or even delay treatment. We can go gentler. Sometimes if there's an injury in the joint, maybe we can adjust it that day. We can focus on some soft tissue treatment or do a laser, other things like that. Sometimes we refer you to another provider. If we take an x-ray, we find a fracture, that's something that needs to be seen by the orthopedist. And then, you know, we co-manage. So we can still adjust the rest of you. A lot of times we'll do laser on them, but the orthopedist is the one who's going to specialize in treating, casting, or if there needs surgery to contain that fracture. And then we're always going to delay care until it's safe for you. What your adjustment should feel like. So generally it should feel like a gentle pressure, a little bit of movement in there. Maybe you hear that little popping sound. You shouldn't feel a sharp pain. So that's always important. It does happen sometimes. You let us know right away. And that's how, you know we have to modify our adjustment, do something different, and always tell us if something doesn't feel right. The more you get adjusted, you're going to be in tune. Your body's going to kind of talk to you, and you're going to know what feels good. You're going to know when you're in alignment. You're going to know when you become sensitive, when you're a little bit out. So always let us know that something doesn't feel quite right if that's the case, so we can make sure we take care of it before you leave the office. Normal reactions. So most people, like we said, are going to feel a little bit better after their adjustment or the same. Some people get a little bit sore. That's okay. Some people even feel a little bit tired. Some people, rare occasions, feel some stiffness. Usually that goes away within 24 to 48 hours and you begin to feel better. When you should contact us right away is if you leave and you have worsening pain. And this is, I can't tell you the last time I got a call like this because it's rare, but if you do feel worsening pain, always call us and we can give you guidance on whether you need to come back here or what you need to do at home, stretching, things like that. If you're feeling an increase in numbness or weakness, dizziness, or really anything that just concerns you that's not the normal reaction that you have, feel free to contact us and we can guide you what you need to do. Your role, make sure you're being honest about your symptoms. Tell us if you're getting better. We're all happy. Tell us if you're the same. Tell us if you're getting worse. We've got to know that so we can modify your treatment and get you the best results. Ask questions. Again, patients who ask questions, who understand their care, understand the why we're doing, the what we're doing, get the best results. That's what we want. And communicate during your treatment. Let us know, oh, my chest is a little sore today when you're pushing on it. So, okay, I'm not going to push on the upper back that hard. We'll maybe do an impulse. Maybe we'll do what we call an anterior adjustment where we flip you over. There's always ways to modify and keep you comfortable, or we use a pillow in those cases. So informed consent, we're always going to explain what we're doing, discuss the benefits and risks, and answer all your questions. Can you stop treatment at any time? Of course you can. Are adjustments forced? No. We try to do it the correct way. That's where our experience and our technique comes in. So we keep them comfortable and we kind of let the body, move the way it's designed to. If I feel, when I'm adjusting you, if I feel things are really tight, they're not going to move. That's usually when I have you turn over, adjust your neck that way, or just change my technique, because we always want you relaxed to get the best adjustment. And then our techniques can always be modified and changed as we're going through care. So the key takeaways from this, remember, chiropractic care is safe when it's done properly. You're in the right place to do that. You've got an experienced group of practitioners who are well trained in adjusting. We have advanced certifications in spinal correction and extremity treatment. So we keep you safe, communicate, make sure you're comfortable, and we want to be your partners in your health going forward. Couple things, just kind of general chiropractic things I always want you to remember. Sickness and disease is caused by deficiencies and toxicities in your body. The number one deficiency is decreased nerve flow caused by subluxation or lack of all those other good essential things, and toxins, whether it be too much medication, over-the-counter medication, stuff we put in our diet, negative thought, or environmental toxins, which are certainly out there. We want to move to living the 6 essentials to help us be as healthy as we can be. We're starting our day with 15 minutes of prayer meditation. We're getting our physical alignment, at least weekly re-engineering adjustments until the x-rays are corrected. We're practicing good posture and ergonomics at home and at work. We're doing our nutritional alignment. We're eating 75% off the vine. We're exercising in alignment every week. We're getting proper rest. We're sleeping on our back with neck rolls and pillows as appropriate, as you're directed to, with our home care. And hopefully waking up without the alarm clock. That's how we know we're good and rested. And then we're removing those chemical stresses, doing a detox every year. So thank you for listening. Feel free, if you have any questions, just let me know next time I see you in the office. For watching, we want you to refer your friends or loved ones. If they have any questions, they can call and they can receive a new patient exam, x-rays, first adjustment for $47. Thank you very much.